So you're looking for ways to help out with your diarrhea. Well, in this video today, I'll give you 5 recommendations that I give to all my patients to naturally help out with their diarrhea. Let's begin. In this video today, I will give you my top 5 tips to help out with diarrhea. And if you wait till the very end of the video, I'll give you my best recommendation for what you can do to help out with your diarrhea symptoms. For those guys who are joining me today, my name is Dr. Samir Islam. I am a poop doctor. Yes, there's an actual job that I have. My passion is to give you tips and tricks to help out with your gut health. If you're new to these video series, I would encourage you to subscribe. I do a lot of topics on education, gut health, overall health, even product reviews as well. For any questions or comments, click on the show notes down below where I post all the things I talk about today. But in this video series today, I'll talk about number 1, the types of diarrhea that we classify, and also I'll talk about the 5 ways that I would recommend to help out with your diarrhea issues. If you're suffering from diarrhea, if you've been told you have IBS, if you have a lot of bowel issues, or you feel just things go straight through you, this is the perfect video to help out, to give you the tips and tricks that I recommend for all my patients to help out with the diarrhea symptoms they may be having. So when it comes to diarrhea, when we have patients who have diarrhea, the way that we think about it in our head is that we classify diarrhea as 2 main types. We have acute diarrhea, which is short-term, and chronic diarrhea, which is long-term. And the treatment options and the diagnosis for both can really change depending on the type of diarrhea that you may have. So acute diarrhea, which is short-term, it's usually due to an infection. The most common reason is that there's some sort of either bacteria, virus, or parasite. You may have been told you have a gastroenteritis, which is typically due to either a viral or a bacterial infection. Acute diarrhea will just last for a couple of days, usually within maybe 5 to 10 days or so, maybe even 2 weeks at a time. And in the vast majority of cases, for patients who have acute diarrhea, the symptoms will resolve on their own. They usually get better, and their symptoms usually go away. When it comes to chronic diarrhea, so lasting for a lot longer than acute diarrhea, that's usually due to some sort of pathology inside the GI tract, whether it's a condition called celiac disease, maybe gluten intolerance, IBS or irritable bowel syndrome, IBD or inflammatory bowel disease like Crohn's disease or ulcerative colitis are the most common causes of chronic diarrhea or long-term diarrhea. This usually lasts about 4 weeks or longer, and this can be intermittent in terms of symptoms. Some patients may have diarrhea, it goes away, then it comes back, goes away, comes back and goes away. Or it can be long-standing. You have chronic bowel issues for longer than 4 weeks. That's how we classify as chronic diarrhea. That allows us to determine what options we can offer for treatment based on what type of diarrhea that you may have. So when it comes to treatment for diarrhea, there are 5 recommendations that I have for my patients who have diarrhea. We'll talk about all these, but how we can minimize diarrhea both in a natural and a more non-medical options. And the first option that we recommend is try to remove what are called FODMAPs. FODMAPs are certain carbohydrates that are naturally occurring that for a lot of people can cause a lot of gut issues. They're present in a lot of foods that we eat, including fruits, grains, and legumes. And foods that are high in FODMAPs can cause a lot of gut issues. I have more videos about what you can do to help out with FODMAPs. Now, when you look at the data when it comes to diet and how you can actually help out with your symptoms of diarrhea, specifically IBS, FODMAPs or removing FODMAPs is one of the very few diets that's been shown in clinical trials to help out with your gut symptoms. So if you're suffering from diarrhea, suffering from bloating, and being told you have IBS, the diet that I recommend for my patients is eliminating FODMAPs. Now, a lot of people come tell me that they feel a lot better when they're on a gluten-free diet or minimized gluten. The reason you feel better is FODMAPs are a part of a gluten diet, and they're a specific part of that. And a lot of foods that are high in gluten are also high in FODMAPs. So instead of eliminating gluten, I would actually recommend removing FODMAPs because the data is very good in terms of the clinical response to removing FODMAPs as opposed to gluten. Now, probiotics is the second recommendation I have for my patients to help out with their diarrhea. Probiotics are beneficial bacteria that helps to recolonize the gut microbiome, and for a lot of people who have acute diarrhea and sometimes even chronic diarrhea depending on the cause, this may help regulate the microbiome within the gut. The best evidence for using probiotics are for those patients who have IBS or irritable bowel syndrome. And there are a subset of patients who may have ulcerative colitis who may benefit from probiotic, but it's not everyone. But we know that the best evidence are for those patients who have IBS. The most effective strain that we have is Bifidobacterium infantis. And so if you're looking for a good probiotic, I have my recommendations, which I'll put down below. But if you have a probiotic that has this particular strain, this is where the best data is for IBS, or irritable bowel syndrome. Try to take a probiotic for at least 4 weeks to see the clinical response. Some people will notice themselves feeling better very, very quickly, but usually I recommend at least a month response with a probiotic before we can say it is working or not working. Now keep in mind, when you look at probiotics, look at the ingredients. Some of the probiotics actually have foods or ingredients that are high in FODMAP, so you actually may feel worse. So the most important thing I recommend is to use a reputable probiotic. I'll put my recommendation down below and I'll have more videos on which probiotic to take. But make sure you take a probiotic that is made from a company that actually does a very good job about making probiotics, and make sure it actually has the particular strain that I recommend, and also make sure it is low in FODMAPs as well. The third thing I recommend is fiber. Fiber for sure plays a significant role in gut health, and there are actually different types of fiber depending on what your gut health and gut needs are. We have soluble fiber, and then we have insoluble fiber. So when it comes to soluble fiber, this allows us to mix actually fiber with water inside the gut. It's found in a lot of natural things, including oats, nuts, seeds, and legumes as well. This actually helps out with a lot of gut issues, including non-gut health, including heart health as well. This helps you to regulate bowel movements and actually may reduce global IBS symptoms. So try to use a soluble fiber. The other fiber that we have there is insoluble fiber, and this is insoluble because it does not mix in with water. And this acts actually as food for the gut microbiome inside the gut tract and helps to balance the gut microbiome as well. And insoluble fiber, because it doesn't mix with water, may increase bulk and also improve the transit time for stool, meaning it allows stool to pass through more quickly and more easily than other fibers that are within the GI tract. Keep in mind, dietary changes can play a very big role with respect to gut symptoms as well, including making changes with the FODMAP diet. There are certain foods and drinks that can really trigger a lot of gut issues and make things a lot worse. And what we try to do when you're having diarrhea is try to minimize these other changes within the diet that can make diarrhea symptoms worse. Coffee is one of those dietary things that can play a big role in your gut health. We know that coffee actually has a stimulant effect on your GI tract. A lot of people drink coffee in the morning, and what that does, it triggers the gastrocolic reflex, meaning that it wakes up not only your mind, but also wakes up your gut, causing your stomach to contract, which in turn causes the small intestine to contract, which in turn moves things throughout the GI tract. For a lot of people who have diarrhea or even reflux or heartburn, minimizing coffee can actually play a pretty significant role in making yourself feel better as well. Spicy foods, we know, can really stimulate the GI tract in terms of making diarrhea symptoms worse, and also making reflux or heartburn symptoms worse as well. So try to minimize spicy foods to see if that plays a role within your gut health. Alcohol speeds up the passage of stool as well. So if you notice your symptoms getting worse with alcohol, that may actually make you feel even worse. And keep in mind, alcohol may have certain carbohydrates or FODMAPs that can make your gut symptoms worse. So it may even be a triple whammy on your GI tract. And then high fructose foods can really pull water into the digestive tract, making your gut symptoms worse. So things that have corn syrup or high fructose corn syrup, check the labels to see if those foods actually may be a common reason why you're having gut issues. And there are a lot of people who ingest high fructose corn syrup and don't even realize that they may be ingesting that, and that may be causing issues as well. And then lastly, high fat foods. We know that high fat foods you may not be able to digest properly, which can cause a lot of digestive discomfort, bloating, pain, upset stomach, feeling like you're pregnant all the time, and also causing diarrhea symptoms as well. And so minimize your fat content as well. And these are some dietary changes I recommend for my patients who are suffering from diarrhea. Exercise. It is so important to exercise. I don't think people realize the importance of exercise on your gut health. Whenever you exercise, it induces endorphins, which in turn can help out to make your gut symptoms feel better, helps out with bloating, helps out with constipation and diarrhea as well. But there are also a lot of extra GI benefits in terms of exercising. Mental health can be improved, heart health can be improved, liver health can be improved as well. And so keep in mind that exercise can play a significant role in terms of making yourself feel better. And yoga can really help out with your global IBS symptoms, especially if you suffer from pain and distension as well. Keep in mind though, some exercises actually may make things worse. For some people, running can really make IBS symptoms worse, including diarrhea, so just keep an eye on that. And there are natural remedies that I recommend to help out with IBS symptoms, including peppermint oil, maybe taking charcoal's tablets, St. John's wort, and other herbal treatments can help out with IBS symptoms as well, so keep that in mind to see if you can have a more natural treatment to help out with your IBS. So in summary, there are a lot of things that we can do to help out with IBS symptoms. Whenever we have diarrhea, it may seem harmless, but it can lead to dehydration and other gut issues as well. The primary cause for a lot of people who have diarrhea is really ingesting certain foods that can really exacerbate or make global symptoms of diarrhea a lot worse, so keep that in mind. Food plays a pretty significant role. Probiotic supplement can be helpful. Remember to take this for at least 1 month to see if it helps out with your global IBS symptoms and diarrhea. For some people it works, for other people it doesn't work. It's a worthwhile trial for those patients who have diarrhea. Exercise can help when it comes to IBS or diarrhea, specifically yoga. Yoga is a very effective option to help out with pain and global symptoms with IBS. And use those recommendations to see if we can help out with your gut issues. My question today for you today, what changes in your diet would you do to prevent diarrhea? Comment down below. Let me know what changes you have made or what changes you have found out to help out with your gut symptoms. My audience wants to know what you have done to see to help out with your diarrhea or your symptoms as well. So comment down below. I'd love to hear what you guys have to say. I want to thank you guys for joining me today. Every Tuesday I do a Facebook Live, and every Thursday I do a Poop Tip Thursday. These are my recommendations for tips and tricks to help out with your gut health. If you like these videos, I would encourage you to follow me on social media, including Facebook, Instagram, and YouTube as well, where I repost these videos on all these platforms. I want to thank you guys for joining me today. I encourage you guys to join me next week while I do some more of my Facebook Lives. Have a good day. Thanks and take care. I want to thank you guys for watching this video. I want you to click here to subscribe to my YouTube page and my Facebook page, and click here to find out what other recommendations I have to help out with IBS or some of your gut issues.